Hello there, my name's Amy Kirkby and I'm a haematology Macmillan clinical nurse specialist at Pilgrim Hospital. I've worked for the Trust for 14 years now and I've always worked with cancer patients. I spent 5 years working on the inpatient ward caring for oncology and haematology patients and also on the chemotherapy suite at Pilgrim Hospital. I've also worked as a cancer research nurse here, recruiting patients into cancer clinical trials and looking after them while they're on the study. I've done that for the past 9 years and for the last 14 months I've worked as an associate clinical nurse specialist, just yesterday being promoted to clinical nurse specialist. So that's a summary of my pathway and I just want to talk to you a little bit about my role and a typical working day for me. The role of haematology nurse specialist is demanding but very rewarding. We support patients with information at the time of diagnosis, when they need to move treatment, when they have any side effects or toxicities from their treatment. Effective communication is essential in delivering excellent care for our cancer patients. The care can be complex, can need liaison with primary care, other secondary care providers, specialist centres, palliative care teams. So we are the linchpin of communication and coordination for our patients. It's essential that our patients know who we are, how to contact us, and how to contact us in an emergency if they're on treatment. So when we speak to patients at diagnosis, we ensure they have all of our contact details and know that we are their key worker and that they're free to contact us with any worries or concerns. Also, that we are the liaison between the consultant and the patient in between times of the hospital appointments. My typical working day can be very varied. We have certain things that we do at certain times, so I know when the myeloma MDT will be, when the lymphoma MDT will be, but we also have a lot of unplanned aspects to our role. It's quite responsive, can be very fast paced. When the emergency bleep goes off, we don't know what kind of call we will be taking, whether we're helping someone to manage a side effect of their treatment or whether we need to be calling an ambulance and arranging an emergency admission. So it's diverse. It's also quite emotionally challenging with the support that we give our patients, particularly the transition to palliative care and end-of-life care. So emotional resilience and looking after ourselves is really important, and we're very grateful to have the support of the hospital wellbeing services. If you're thinking of a career in Macmillan as a cancer nurse specialist, I would say go for it. It's absolutely brilliant. You get to know the person behind the diagnosis, you become a specialist in their cancer, but also your knowledge of them as a person. So good luck. If you have any questions, please feel free to contact me via Teams or email and I'll be happy to discuss further. Thank you.